Welcome everybody to our webinar, our sponsored webinar. Nesta is going to be sponsoring today's webinar. We'll be hearing about bioregulation therapy in action. Before that, we do have a couple of brief announcements. The first and most important is that our annual NRBS conference is coming up October 24th to the 26th in New York City. So come join us. We're having lots of great speakers, and we'll put the registration link into the chat. Please do come. It will be, I think, a really fun and interesting and engaging conference. I also wanted to let you know that this Tuesday, the first Tuesday of every month, we do have a connection, online kind of connection where we'll be discussing we've been discussing various topics related to trying to expand the use of bio and neural feedback in different venues. And that is at 12 o'clock Eastern time. And I also want to give a little plug for our NRBS podcast. I will put a link to that into the chat. Most recently, I've been talking with some of the presenters who will be at the conference, so you'll be able to get a little bit of a preview. And listen to it, subscribe, leave reviews, let more people know about bio-neurofeedback and psychophysiology. For this webinar, if you have questions, please put them into the chat and we'll take 10 or 15 minutes near the end to go through them and answer the ones, as many as we can. So let me do a quick introduction. As I said, we're going to be talking today about bioregulation therapy in action. And one of our presenters, Dr. Cynthia Wilson, who is a licensed psychologist, also board certified in neurofeedback and in quantitative EEG. She is down in Panama City, Florida, and works in a lot of, not just in psychophysiological, but also mental health, behavioral health, trauma, ADHD, and mood disorders. She's been working for 20 or so years in this field. We'll also hear from Dr. Harry Bakal, who is a practitioner up near me, actually in Lexington, Massachusetts, has worked in this area for a long time and is doing neurofeedback, both using the EEG, but also the lens type of neurofeedback, and has been using the CellCom device for the last 4 or 5 years. And I'm sorry, I don't have a bio for her, but we'll also be first hearing from Laura Popek, who works with this system as well. I'm going to turn it over to Laura. And again, any questions, please put them into the chat.
Thank you. Thanks everyone for attending today. We hope that you find this very useful. Just a little agenda so you have an idea of what the call will look like today. First, we're going to have a very brief overview on BRT. If you're not familiar with it, or even if you are, it might be useful to know exactly what it is. And then we'll be hearing from both of our guest speakers, case studies from them as to how they have used BRT and how they have found it successful in their practices. So what exactly is bioregulation therapy? So bioregulation therapy, BRT, has been around for years, but it's quickly gaining traction because of its benefits. It uses gentle electromagnetic signals from the body to speak to the body's cells. So it actually measures the electromagnetic field within the body and then translates back to the body based on what it is getting. So it really is a connection between the mind and the body. Some of the benefits of BRT that practitioners have found is that it really helps to release emotions that have been stored in the body due to previous trauma. And that's really where they have found BRT to be very successful. So how it works is it uses PEMF, which is pulsed electromagnetic field, to help to boost cells' activities and also boost overall well-being after patients have used it. So we have a couple of different devices that we use. One being the Cellcom, which uses a combination of BRT and PEMF in one device. And then we have another product line, which is Nesta. Nesta uses 4-channel PEMF, and within that, we have a Nesta Pro, a Nesta MetaBalance, and a Nesta Child. So the difference is the MetaBalance is really about overall well-being and offers a different set of programs to it. And child obviously is pretty self-explanatory. It's really geared toward children who might have some deficiencies that can be corrected using the devices. So let's talk a little bit about the differences. So you can think of Cellcom as kind of a loop. So it takes and reads the signals from the body. It uses wires as well as a pad to be able to gain the signals from the body, and then filters it, reads it, and then sends those messages back to the body. And the benefits are many because it's actually using what the cell is doing and then sending it back. So it's taking the input from the body and then using it and outputting it back to the body. The Cellcom is FDA approved as well. So as you can see from these pictures, this is kind of how the Cellcom works. As I mentioned before, there's a pad. It connects to little kind of electromagnetic microphones that read what the cells are doing, analyzes it, and then it's sent back to the body. So this next slide, it's very easy, the software, it's fully automated, and we offer hundreds of different combinations of programs. So it can be very customizable based on what the patient is presenting and what type of issues and challenges that you are trying to overcome with the patient. So again, hundreds of programs. The software is easy to use and download, and it's as easy as moving it around within your practice.
Mm-hmm. And Laura, I can help with this section here, which is talking about the Nesta devices.
Sure,
So
go ahead.
Nesta devices are really threefold, as Laura mentioned: the Pro, MetaBalance, and the Child. And the Pro is primarily a professional unit for your office use. MetaBalance and Child are mostly designed for home use with different types of programs. What's unique here is that we are allowing now this product to be a home use product as well, which is very valuable because it's super easy to use. As you know, when you have a home use device, a lot of times the results are mixed because compliance is an issue. It can be too complicated for the client and whatnot. Here, in this case, because of ease of use of these devices, essentially they can wear the device with a lanyard around their neck, and they can go about their day without being hooked up to any wires or any computer screen. It really allows them to work with the challenges they have. For example, if somebody has an anxiety issue and you're using the anxiety protocol, they simply wear the device around their neck with a lanyard. That way they can go about their day, go to school and go to work, drive their car, and able to use them every day, either as a remote client for you, or it could be someone that uses between neurofeedback or BRT sessions in your office. So what we are doing is essentially providing you a way to be able to offer this to your clients at home. And we're putting together a package that's going to be launched next week, essentially to talk about how they can do this at home. We're providing a rental template for the clinicians who want to potentially rent it to their clients, or just all the other tools that they would need to be able to get FSA, HSA reimbursements. They will definitely save quite a bit of money with this home version. That's going to be a pre-packaged version where they don't need any computer. It will basically programmed for them to be able to use at home based on their needs defined by the practitioner. So those are all available to the practitioners to be able to offer it to their remote clients or clients who really need extra help between the sessions. That's kind of the overview of the technology. As a very brief, we mentioned the biofeedback PMF combo with the Cellcom, and then we talk about the Nesta platform, which is the new mobile platform, which is a 4-channel PMF system. So with that brief introduction, we thought it would be helpful for us to share this so that when we talk about the different cases and talk about different devices being used, it's easier for you to grasp what we're talking about. The Cellcom essentially is a device where you have a biofeedback feature, including the PEMF as well. And the Nesta platform is the portable platform, which is PEMF only, right? So with that, I'm going to move to the next section, which is the case studies. We're starting with Dr. Beko here. Dr. Beko, can you see my screen?
Oh, hello, everyone. I'm kind of identified with what it must feel like to sit in the office, in the audience, and wonder about this technology. I had the same experience with a very good colleague of mine, Mike Cohen in Florida, who was one of my original teachers. Some years ago, right before the pandemic, Mike gave a webinar similar to this, and I came away from it feeling like, sorry, but that just sounds too good. Forget it. Then the pandemic came on, and one of my clients happened to be stuck in Florida, not too far from Mike's office. And so, given that she was stuck there and was experiencing a lot of anxiety about getting back home, I suggested that she call Mike and set up an appointment to experience the CellCom, which she did. Her experience was so good that her comment to me was, "You have to buy this." And of course I did. And it's gotten a lot of use since 2021. One of the things that I thought of, as um, perhaps many of you do, is that in our work, we have so many kinds of intervention, but most of those interventions we typically use in a sequential way. It's unlikely that you'll be doing vagal nerve stimulation while you're doing neurofeedback, or perhaps you might do entrainment when you're doing neurofeedback, but the likelihood is that most of the interventions are sequential. To me, the advantage of what you're hearing about today is that you can use the CellCom concurrently with neurofeedback, which I feel is a big advantage. For example, in comparison to neurofield, which, those connections are set up on the head, none of the connections to the CellCom would interfere with doing neurofeedback. I wanted to mention that recently I heard David S. Cantor talk when he gave a seminar, and for someone in his position who is such an expert on psychopharmacology, one of the things he brought up was the complexities of doing neurofeedback with symptom pains. And given that pain is such a complex set of symptoms, he suggested that perhaps PEMF might be a good either intervention before starting neurofeedback or during neurofeedback. And that's exactly what I've discovered. One of the issues in having a colleague in Florida, such as Mike Cohen, is that we often share referrals with families that we identify as snowbirds. So they're in Florida for 6 months, and then they're up here for 6 months. And I'll see them when they're up here, and then they go back and they'll see Mike for 6 months. I bring this up because I recently have started working with, well, not recently, let's say in April, with such a snowbird that Mike had been seeing for the last 6 months. And I bring this up because apparently Mike's format is to do neurofeedback and then to use the CellCom at a separate time. which he doesn't have to do, but I guess that's the format that he's chosen. However, since I do both at the same time, her comment was that she noticed an enormous difference in the outcome. And it's something that she wants to bring back to Mike and talk to him about doing both concurrently. So having said that, I know there's a few case studies to go over. This first case study, I want to tell you, is my wife. And the reason I'm telling you that is because I want you to know that there's not an issue of time, money, energy, in terms of trying to solve this problem. I don't have the normal constraints that I might have in seeing a client who can only afford to come for a certain amount of time, etc. We've tried everything to deal with her sleep dysregulation. I consider it very, very serious because it does mess with a lot of her functioning. And she's had a great deal of assessment in the Boston area. And I've done neurofeedback with her at least for 10 years, amplitude training, Z-score training. She's done multiple other interventions, vagal nerve stimulation. We use something called the V-light, which is photomodulation, which I think I find to be a very useful intervention. However, it wasn't until she started using the Lux Pro, which is a PEMF device. It's not biofeedback, but it's something that most clients will use in the nighttime. And you program it, and you can have up to 3, 4, 5 hours of programming. And it is the one intervention that has made the difference. So it's something that is set up alongside her bed, and she turns it on when she goes to sleep, and that's it. So during the night, she experiences the benefits of the programming that I've set up, and it has been the only intervention that has yielded somewhat consistent results. It's not that she's a fine sleeper at this point, that's not the case, but she's nowhere near where she was. And fortunately, she's been able to stop using Ambien. So, from my point of view, it's a huge success. This is really an interesting case in the sense that this client has had multiple trauma. Her mother passed away when she was 7, and the family situation was very difficult from that point on. She developed anorexia early in high school, and it finally got resolved by the time she went to college. We've been doing neurofeedback, both amplitude and Z-score training over a number of years to deal with PTSD. However, the real challenge came when she started to develop very, very severe menopause symptoms. And as working as an actuary at a high level, symptoms like brain fog, fatigue, distractibility were literally undermining her career. And her options were actually zero. Because of a history of breast cancer, her gynecologist would not support using hormonal replacement therapy. Fortunately, the CELCOM has specific programs for menopause. And those programs, I believe, literally saved her career. So the menopause, of course, will wind its way along its own path, and who knows how long that'll go on. But the research is that with women who have severe menopause symptoms, they're out of work by the time they're in their late 50s because there's very little way to resolve those symptoms. Fortunately, in this situation, because the CELCOM and its ability to work in a concurrent way with neurofeedback, I feel like this client has a chance to continue her career and be successful. This is a really challenging, difficult case. This is a physician who has worked at a high level administratively for many years. She's worked in the Boston area. She has a very strong network of physician colleagues. In the last year or so, she developed respiratory symptoms, which quite simply would be defined as hyperventilation. Um, there is a specific medical term for it, but the hyperventilation was such that as long as she was lying down, she wasn't hyperventilating. As soon as she got up, she started hyperventilating. At its worst, she was hyperventilating 60 times a minute. With off-label medication, she's reduced that to between 30 to 36 breaths per minute. She has had every possible medical assessment you can think of. She's been seen at the Cleveland Clinic. There have been no real advances in intervention. The medication she takes is off-label. It's the same medication that's used for chronic fatigue. She's almost out of options medically. At this point, she's considering applying to the Mayo Clinic. However, the CELCOM has specific programs for breathing and for lung function. The CELCOM has given her an enormous amount of relief, which otherwise she would not have, not at all. So with the CELCOM use on a regular basis, she's able to bring her hyperventilation down to about 20 breaths on average per minute. In fact, the CELCOM has become so important in her life that she bought the device for some $23,000 so she can have it at home and use it as much as she needs to. Given that it's really the one of very few options for her at this time, and it's not clear going forward, given all of the assessments that she's had, that she'll be able to find relief in any other way. Well, I mean, of course, we hope so. She also bought the Lux Pro to have while she sleeps at night, which complements the CELCOM, and she's very happy with that. This is a young woman who was sexually abused from the time she was about 7 to 11 years old. In fact, this case was so difficult that her mother consulted a lawyer, and what ended up happening was my client, successfully sued her father and got a settlement. It just gives you a feeling for how outrageous this whole situation was. And in fact, it was the first successful case in Massachusetts of a child suing their father for sexual abuse. As you can imagine, there's been a great deal of PTSD trauma symptoms that have developed that have affected her in a number of ways. Most recently, she's developed fibromyalgia symptoms that she's been unable to deal with in a medical sense. She's consulted a number of physicians. She's explored a number of alternative interventions, hypnosis, and so forth, acupuncture, you name it, with very little relief. However, the CellCom has specific subprograms for fibromyalgia that I've been able to use with her successfully when she has an episode. And I would say, and I think she would agree, that it's the most successful intervention for her fibromyalgia that she has tried. So, having said all that, I want to talk about my most memorable CellCom case. One that I just have so many positive memories of, and that is of a dog named Lucky. So I started seeing a woman who lived alone, was single, didn't have roommates, and didn't have a partner, but she had a dog named Lucky. And when I met Lucky, when I first started working with her, Lucky was about 10 years old. So over the course of several years, Lucky started to decline. And by decline, I mean develop very, very severe arthritis. Often had to be carried in order to urinate and so forth. Was in a lot of pain. And my client had to keep wondering about putting her down. Well, I suggested let's try the CellCom. Um, anyway, so we carried Lucky into the office and laid her down. I put the plates on her using pieces of cloth to tie because we couldn't use Velcro, of course. She laid on the pad, and I picked subprograms that I thought might be effective for pain, arthritis, so forth. And lo and behold, within a few minutes, maybe 5 or 10 minutes, Lucky was asleep. And I just kept the CellCom going for about an hour. And when Lucky got up, she didn't appear to be in distress. In fact, I'm on the second floor. She went down the steps by herself, and those positive results lasted for several days, and then my client would bring her back for another treatment. This went on for several months. I had the vet call me and say, "What's going on over there? Uh, we can't account for this improvement, even though Lucky was on, of course, medication for pain." Um, this went on until her owner, my client, decided that Lucky was just in too much distress to keep living, and so she put her down. But it's really my favorite story of the CellCom, because who would anticipate that PEMF would work so well to help a very sick and dog in a lot of distress? Anyway, those are my comments.
Thank you for sharing that. As a matter of fact, it's quite common in Europe to use this kind of technology for with animals. They tend to respond faster than humans in general because they don't have interference from other mental challenges, I should say. So with that, I think we're gonna thank Dr. Bako here, and we're gonna go to our next case studies with Dr. Wilson.
Hello, everyone. So I have a different setup with my practice. I'm traditionally a psychotherapist, and about 12 years or so ago, I added neurofeedback to my practice and then QEEG. And about a year ago, I met Terrell at the ISNR conference in Chicago, and we were sitting at his vendor booth. And as we were chatting and networking, he had me sit on the Nesta Pro. And at the time, I didn't feel anything. I just kind of was like, okay, sounds good. Thank you. And we met and we chatted. And then the next day or that evening, I actually slept really well, which is uncommon for me when I travel. So the next day I also felt better. I was able to tolerate being in an all-day conference a little bit easier than I would normally have done so. So because of that, I started to do a little bit of research into the PMF therapy and purchased the Nesta Pro. I've integrated into my practice pretty much on a daily basis, and I will sit it behind an individual while they're doing therapy. I'll sit it behind an individual while they're doing neurofeedback, sometimes horizontally, sometimes vertically, because if you see the mat, it's a more of a rectangular shape. And then I track symptoms with a simple Likert scale. How you're feeling in the beginning of the session, how do we feel at the end of the session? And a lot of it is a feedback from a self-report. I don't have any measures outside of that. The device doesn't allow us to do that so much. So saying that, I do have a couple of case studies that I have found it to be quite helpful for. And whenever you're ready, Terrell, I'm ready for you.
Sure.
My first case study is just a psychotherapy patient. We're not doing neurofeedback at this time. Excuse me. Actually, yes, this one is. It's a 46-year-old female. We are doing neurofeedback and we're doing some psychotherapy. But this person called me on a Monday morning and said that they have been in panic mode for a few days. She has a diagnosis of PTSD, chronic panic disorder. So that was the reason she came into my office to begin with. When she came in, she was so overactivated that she was, visually shaking, and her sympathetic nervous system was very activated, and she couldn't get it to calm down no matter what she was trying to do for a good 3 days. So we sat her down, put the Nesta Pro behind her. I picked a protocol that was a calming protocol, and we did a neurofeedback session. And she went from a 7 at the beginning of the session all the way down to a 1 at the end of the session per her self-report. And she called me a little bit later and said that after an hour after the session, she actually felt a little bit better. And we hypothesized that, well, the adrenaline and the cortisol and then everything had started to calm down in her body. So she had, immediate results in the session, but then after the session, she actually felt better because of the chemistry had burned off in her system. Go ahead. The second one is very similar, but we only did psychotherapy. We did not do any neurofeedback. So she is diagnosed with adjustment disorder, and she's had a very hostile work environment, which has caused her to be very anxious on a daily basis. The anticipatory anxiety of just going into work has caused her quite a bit of distress. She's also in some complex grieving. She lost 4 family members in a very, very short period of time. And so what I observed there was she came in, again, visually anxious, visually upset. We put the Nesta Pro behind her, and we were able to have a much more productive psychotherapy session because we were able to get her out of that limbic stage of just being stuck in that sympathetic nervous system. And we were able to go from an 8, and she reported a 0 at the end of the session. Now, psychotherapy can help with that, but I've never had someone come down all the way down to where they have said they have felt nothing. She's doing very well. She's kind of was able to get her emotional anticipatory anxiety under control, and was able to make some really important decisions on changing her trajectory in her job and with her family dynamics. In this last study, is probably one of my most interesting because I've been working with her for such a long time. And when she came to me, her mother had pretty much exhausted most of the mainstream type of interventions, ABA therapy, different kinds of behavioral therapy, and none of it was very, very helpful. As you can see, she has Down syndrome, so she has some congenital genetic issues, and she's been diagnosed with autism and intellectual disability disorder. And globally, she is just developmentally delayed. So when the mom came to me and said, would this be helpful? I said, talking about neurofeedback at the time, and I said, to be honest with you, I'm not sure. We had such global developmental delays that if we do have some improvement, it will take some time. So we laid out some expectations and some limitations of what I could and couldn't do. So some of the big things that she's had is motor skill delays, speech language delays, cognitive delays, social emotional delays, incompresis, enuresis. So again, in all arenas of her life, she's had some delays. So with ongoing neurofeedback, we've actually made quite a bit of progress. Emotional regulation came first, sustained attention, being able to be present. Her executive functioning and communication, language communications all started to improve. And again, a very, very slow, gradual process. And we're really pleased with what we were doing with neurofeedback. But when I came across the Nesta Pro, I asked the mom if we were able to add that to her treatment plan, and she agreed. So we put it horizontally behind this child, actually a young woman at this point, and we have been able to see some changes primarily with her energy levels. So before, she was very lethargic, not really motivated to, grab what she needed, what was just right next to her. So she was able to be more motivated. And the two big things that we saw after we started to see the energy levels change was the self-prompting to go to the restroom. She even woke up in the middle of the night for the first time ever in 20 years of her life and was able to go to the restroom, self-prompted, informed the mom she needed to go, and then returned to sleep without incident. And this was approximately after 8 sessions of adding the Nesta Pro. Now, after a long time of neurofeedback, we had never been able to accomplish that. We did some enuresis and incompresis type protocols and got a little bit of a nudge, but we've never got any self-prompting at all. And she's continuing to do that. And although that may not seem like a big deal for someone who has some developmental delays, this is increasing her independence as well as helping the mom as a caregiver not have to, go through all of those processes every day, all day long. The second one is that she went to the cardiologist, and she's been going to this cardiologist her whole entire life. She had some heart surgeries when she was very young due to the congenital delays that she had and issues. So this cardiologist has been with her the entire life cycle of this individual. And what happened differently here is after 10 sessions, they took her to the cardiologist, and she was able to jump up on the table and lay down in a flat position to be able to be assessed. And that may not seem, again, like a big deal, but prior to this, she had to have 3 individuals help her onto the assessment table, and then to lay down because of her posturing with the autism spectrum stuff. She couldn't just lay down, but this time she was able to just come in, lay down, be assessed, and the cardiologist was like, what is this madness? Like, this is different. So those 2 things were huge, because those were 2 things that were first of all, never happened before, and 2, it came from an outside source of like, this is different. We've been working with this individual for a long time. And now when she comes in, she asks for the mat. If the mat's not in the chair, she'll be like, she won't sit down in the chair until the mat's in the chair. And that is kind of saying something, because she's not able to necessarily like say, hey, the mat makes me feel this way or that way, but she is asking for it. And so there is some differences there with just being able to advocate for herself and to ask for things that she feels is helpful. So those are my 3 cases that I found to be very helpful, and only in a year's span. Again, I only purchased this Nesta Pro approximately about a year ago when we were at the conference in Chicago. But I use it on a daily basis. I've added it to the practice. I use it with my psychotherapy clients, and I ask and with neurofeedback. And now I have people just asking me, well, where's my mat? So that we need the mat in play. And saying that, I have a technician that works with me. And so we were triaging patients on who would need the mat more, who would be benefit from it more. And just recently I did go ahead and purchase a second mat. So I have one in each office now that we're able to utilize.
All right. Thank you so much for sharing these cases with us, Dr. Wilson. I think that's all slides, right, Laura? This is all we had for today from our guest speakers.
Yes, and we do have a couple of questions in the chat if you'd like to address those.
All right, let's take a look.
Yeah, I can
Go ahead.
So one question is about how does the device send messages back to the body, and what's that based on? I think that might be about the Cellcom.
Yes, it's
How that
actually,
work?
it's
Yeah.
good, great question. It's the best way to describe it will be similar to an advanced GSR system where you're essentially uh, changing or adapting the therapy based on real-time feedback loop from the GSR system.
So is it a galvanic skin response?
Yeah, it is.
It
It
is.
is. We call it GSR plus. It's
Mhm.
GSR, but it has some additional elements to it that are proprietary. Between the two, it
Okay.
provides a way to customize the therapy during the session real time.
Okay. So it uses one of the oldest biofeedback modalities in a new
Yes,
way. In a new way.
correct. And
Uh,
it is unique in a number of ways because it is in real time and it's fully automated. So you as the practitioner don't need to actually intervene with the process. Once you set up a protocol, so for anxiety, it will automatically run that session. And we have seen that that custom session makes a big difference for the client versus a system where there's no feedback.
There was also a question about finding a practitioner in a particular place, but I guess I want to generalize that. Is there a practitioner directory?
Yes, we have actually, we're just revamping our webpage, so we will be able to share that with everyone. We have practitioners in many states right now. As a matter of fact, I see some of our practitioners joining today from different states. We have a couple in New York, we have Oregon, we have California. We have most of the states, I think, at this point covered. Of course, Florida is a big state for a lot of these kind of therapies. So if anybody has specific request or need, we'll be happy to connect them with a practitioner in the area. And if they want to go try it for themselves, that's also an opportunity as well.
Another question about practitioners. Can you speak to the GSR mechanism? I've been taught to do GSR on the skin, but it sounds like the client sits on the mat. Wouldn't clothes get in the way of getting a good reading, good galvanic reading?
Great question. Let me just go back to the slide. When we talk about the Cellcom, there's actually a skin connection, right? So the Cellcom comes with the sensors and the pad. So it combines both the biofeedback plus the PMF in one system.
I have a question actually about the PMF. So first of all, the use of it, and this is just a general statement, make sure that that is covered in your license. PMF is not always covered. But my question actually is about, are there any reasons not to use it, or are any safety issues
Yeah, great
related to the
question. There's
magnetic?
a couple of areas that we can say that we would not use the system, and it's not specific to our system, but in general to these kind of systems. One is obviously pacemakers, right? So if anyone has a client as a pacemaker, we would be very cautious about that. Our systems, both the Cellcom and the Nesta, are battery operated systems. So there's no AC voltage, anything like that. It's very low energy systems run with batteries, but still we would not use it with someone who has a pacemaker. Or if you have someone has an electronic implant in the body, it can be a specific insulin pump or something like that that has electronic components inside the body. We would not use it. Again, it's a very low probability, but it's just a general risk factor. And anyone who has an uncontrolled blood pressure, we wouldn't use that because these kind of therapies would increase the circulation and that make slightly elevate the blood pressure. Anyone with seizures, although I have clients using with seizures with great success, we will also caution with seizures. Other than that, any kind of metal implants in the body, any kind of injuries or other types of interventions are totally fine. It can be used with neurofeedback simultaneously as well as a completely independent system. As a matter of fact, a lot of our users are not neurofeedback practitioners. They are functional medicine providers or functional chiropractors who add this to their practice because of the breadth of the different types of protocols available, all the way from anxiety, ADHD, OCD to fibromyalgia. As a matter of fact, we did a little pilot study at UCLA with Dr. Zirov, Professor Dr. Zirov, on fibromyalgia. We were not able to complete it because fibromyalgia is very difficult and a lot of people dropped out halfway. But we had a good 18 cases that we started with. We ended up with a handful at the end that could complete the 9-week study. But all of them who could continue the study reported good results with the fibromyalgia. We have that protocol. Specifically, we have autism as another area that we are very good with. As a matter of fact, we have now some international clients from Australia and Brazil, working with larger autism clinics there. So we're doing quite well with those kind of uses as well.
I- Why do you think it works with autism? I'm really curious about that.
Yes, it actually works with the central nervous system, right? That's fundamental. So if we can calm the body at the body level, then everything else moves so much faster. So one thing I always say is when we work with kids, and we did a little pilot study in Florida as well with 9 children, and what we've seen in that one is the kids could stand still and on that chair for 40 plus minutes without complaining. You would hook them up and they would just say, close the door, leave me alone, I'm good. And that was pretty impressive because that actually improved their um, uh, overall response to external stimuli, but also made them sleep better and be more calm. And they actually had more eye contact. So I think the key thing there is to help them give them something that really calms their central nervous system. That's the fundamental thing they need. Other than that, you can do neurofeedback, you can do other types of therapies. But if you can start with the BRT, that makes a huge difference. Some of you may know Dr. Roseanne, who's in Connecticut. She has a large practice working with kids in the spectrum, and BRT Salcom has been a part of her practice for several years now. So it is something that really works over and over, and we have been able to improve those kids' lives, which is very, very important and significant for us.
Well, there don't seem to be more questions in the chat at this point. Are any of the presenters have any last words to share with us?
Yeah. And if anybody from the audience, if anybody wants to have additional questions that are not being raised yet, or if they want to share anything, that would be also helpful.
I have found that when I have questions, Terrell is very, very quick to answer my questions too. So, and to provide demonstrations. At first, I did not understand everything that was happening as a mechanism of action. I think my brain works as like, okay, well, what are we doing? What's the mechanism of action? And so to have that understanding, and then to really just give it a shot, I've found that it's been helpful with most of my clients. I've had a couple that have been so just with trauma dysregulated that they find it to be a little uncomfortable. So sometimes we don't use it at all. Sometimes we'll set it beside them, and so we'll put it on the most sensitive setting. So I've found it to be helpful in things that I would not have thought it to be helpful with. For that last case study with that young lady, I would have never. Those were not my expectations. Like I had no idea what to expect. So I would say keep an open mind because it is a very nice intervention to have. And for my practice, I have it as a supplement, but it's always been very nice just to add it as, I've gotten better outcomes for that reason.
A question did come up about the mechanism of action, whether it's documented anywhere, like on your website.
Yes, we have a white paper. We're happy to share it with anybody who's interested. We have a white paper we can share that's detailed. We also have done a anxiety study with 30 participants in here in Virginia. So we're happy to share that information as well if somebody's interested in some of that data. Lara is our contact person. If anybody would like to get more information, you're welcome to scan the code that gives you a chance to set up a demo. And Laura's here. And then Lara, go ahead and share your email address. That's pretty easy for people to remember.
It's just lara@bioreg.us.
Yes.
If you have any questions, we're happy to answer them at any time. And I'll also put it in the chat.
Okay.
Any other last words from our presenters? Okay. Well, thank you all for coming to join us and learn more about BRT. And I will just leave you with the urge you to come to the conference in New York City, October 24th to the 26th. It'll be a good time.
Yes, and one more thing, we will be there as well. So if
Yes.
anyone would like to come and see us, we'll be attending as a vendor to this event.
Thank you all for joining us. Have a good rest of your day.
Thank you.
Thank you.